Okay, all set?
Yes, sir. Thank you.
All right. Sorry about the delay, a little technology issues there. Good afternoon. I will be joined by Secretary of Health John Weisman later for questions. First off, I'd like to say I'm very pleased that tonight will be the first meeting of my task force on independent investigations regarding the police use of force. And I have convened this community group to give us insights and ideas on how to improve our state system to make sure that we have very credible independent investigations and independent decisions about criminal prosecutions in cases involving the use of police force. I want to hear the views of this panel. I'm very excited about the membership, and I'd like to know whether they think we need to improve our system or whether we need to have some entirely new system investigations and prosecutions. It does bear repeating why I've convened this group, and that is the reason is to make sure we have fair and impartial investigations and prosecution systems in our state. We know this is part of dismantling institutional racism and ensuring fairness and equity in our criminal justice system in our state. I'm really happy about the membership. The task force includes community members who have lost loved ones involving the police use of force, as well as religious leaders and advocates for justice in our communities, and representatives of law enforcement as well. And I look forward to meeting with that group later this evening. Now, it is important to realize this is just one of our issues. The issues of independent investigations is one of the issues that we will have discussion with legislators in the next session. These coordinators' efforts with the legislators are getting started, and I'm glad we're starting that this evening. I'd like to talk about our plans for schools this coming fall. We have seen the White House again threatening to attack our state, and they've really, President has picked some peculiar foes to want to have as your foes, and that is students and teachers and families who want the state of Washington to make a decision by the state of Washington for the state of Washington students, and that is our goal, and we will hew to that course. As you know, the president has threatened our colleges and universities. Yesterday, they attacked our K through 12 students by threatening onerous penalties if somehow we did not bend to the president's will. Well, I just want to say this about his threats. They are hogwash. As with a lot of their claims, they have tried to bully us into making decisions that are not best for the state of Washington, and we know this. Decisions about school and how to have it on site or otherwise will remain with the state of Washington. These are Washington students, and Washington State has the legal authority to make decisions about their education. Now, unfortunately, this has been a pattern with this president. He has made a pattern which is unbelievably callous of holding our children as hostages in some sense, to treat them as pawns. He did that in immigration, in his cruel and callous child separation policies. He did it in threatening and is continuing to threaten our dreamers, who are some of our most ambitious students in our state. And now he is trying to treat them as pawns to try to dictate to the state of Washington. We have not been bullied. We are not going to be bullied, and his bullying will fail yet again. And if it's necessary, of course, we have the courts available. So as a report, our state and local districts and our universities have been working diligently for plans on this fall. I want schools to open in a manner that maximizes learning while simultaneously is safe for our students and the wider community. And we will follow recommendation of our state and national health and safety experts in this regard. I have confidence that our state superintendent of Education, Chris Rakedahl, will ensure local plans will meet requirements for health guidance. And I'll be meeting with him next week to discuss our progress, to see about some of the specific plans that school districts are already considering about how to go about this. I think it would be well for the president to follow the guidance of his own Centers for Disease Control. That largely aligns with our state plans. The CDC director deserves recognition for refusing to disregard the very real public health concerns in determining the best way to safely educate our students, including on-site education. Now, we continue to work hard to slow the spread of COVID in Washington, even as the president has downplayed this threat, which is endangering the health of Washingtonians, unfortunately. But here's some good news, and as I talked about yesterday, there is good news. Perhaps the best news is the public understands that we are in a fight involving life and death, and Washingtonians are committed to work together to win this battle. It's clear that the majority of the public is with us on issues of masking up, of physical distancing, and reopening our economy at the right pace. Despite bluster from the president and some others, including some elected officials in our state, these attempts to distract and diminish the severity of this problem have really failed. The people of Washington support the steps we've taken, and polling backs that up even nationally. I read a poll from Monmouth University that said that 83% of Americans now report wearing a face mask when they leave the house, while 9 in 10 are maintaining their distance from others. Similar from Monmouth University polling showed that nearly 2/3 are more concerned that states are starting to lift restrictions too quickly, compared with 27% of those who are more concerned that it is happening too slowly. Now, we have some sad news from other states that have made some different decisions. The New York Times reported today that the surge in COVID cases nationally is largely driven by states that reopened too early. And now we know that the spread is ticking up in Washington state, but our stay home, stay start, and safe start proclamations have clearly helped us to avoid the kind of spread that we are now seeing in some other states. So the upshot of this is that we are going to continue to help Washingtonians continue to do the right thing. Mask up, do physical distancing, do everything we can to open up businesses and restart the economy. At the same time, we're protecting public health. Now, I want to tell you that so far we have seen really good teamwork by state of Washington citizens across the state. We're seeing a quite rapid rise in the use of masks. I was really pleased to read in, I think it was the Seattle Times, an article about businesses are accommodating this, and it's working really, really well with minimal tension. This is working, what we're doing, and Washingtonians are stepping up to the plate, because we do realize, and the very, very first thing I think I ever said in my first press conference about this is we are indeed all in this together. So the last few days have been very gratifying to us, but it isn't 100% quite yet. I read about a chowder restaurant in Seattle that had flaunted our health concerns for their employees and their customers, and they had to be closed down by the King County Health Department. By the way, that was not Ivar's Acres of Clams. We know that if any employees are working at a place where they're told they can't be treated or are not having safety recommendations followed, we need them to talk to their local health jurisdictions or the State Department of Health and Industry so we can get that problem fixed. That lack of adherence will not be tolerated. The health and safety of employees and customers is something that is our primary objective here. But I don't want to diminish the huge amount of success we are having with great business leadership that is helping not only restore our business, but doing what's necessary to do that, which is to mask up so we can reduce this COVID pandemic. Example, thanks to a Seattle-based Starbucks, they're helping to normalize mask wearing. They've decided they're going to have mask wearing throughout their stores across the nation. even when it's not required by local health officials. That helps us with our messaging. You know, local businesses are doing it too. I know they're doing it in droves across the state. Essentia Bakery in Yakima has required on their own decision-making customers to wear masks since June 16th. That was well before we required it. And things I'm told are going well. So thanks to the small business people who are reopening their businesses and also trying to keep this pandemic under control. So we want businesses to reopen. We want people to get back to work. We want people to be healthy. And we can do all those things, and Washingtonians, I think, are again leading the way in this effort. So with that, I'm happy to stand for questions.
Visitors.
Rachel, are you with us? Are you muted by chance? We're checking a little technology here to see if.
1 second, everyone bear with us.
If everybody can just hang on a few beats here.
Rachel, could you try one more time? Okay.
Hello.
Just turn on.
Hello.
Rachel, I heard your voice. We have some reverb here. We're working on our anti-reverb system. You can just hold on just a few moments here.
Sure thing.
Okay, Rachel, give it a go now.
Okay, can you hear me now?
That's great. Thank you, Rachel, for your patience.
Hello?
Yes, Rachel, we hear you loud and clear.
Hello.
We hear you loud and clear.
Okay, great. Governor, 17 states have some sort of restriction in place for visitors, whether it's a 14-day self-quarantine requirement or requiring proof of a negative COVID test. So with our state starting the peak season for travel here, is that something the state plans to do heading into the summer? And if not, why?
We do not have current plans to do that, but these things are under consideration all of the time. And we're continuing to monitor the other states and the frequency with which they travel to Washington State. So far, I don't believe we've seen at least evidence of that being a difficulty, but that could change in 24 hours. So it's one of those things that will continue to be considered, looking at the rate of progression of our virus, and we do that every single day. Today, the early reports, I think this morning's were 640 some new infections at I believe a 5.6 positive rate. And so that's been relatively stable for the last few days, but we look at this every single day. So we'll make decisions if in fact the conditions warrant. We would be willing to do that. So stay tuned.
And just a heads up for everyone, we're not going to do follow-up questions today. If you have some, you can email me and we'll get you the answers. With our technical difficulties, we're just going to try to get through as many as possible. Our next question is going to come from Essex. Essex, you're unmuted.
Governor, a question for you and also a question for Secretary Wiesman. For you, Governor, are you truly willing to risk the loss of federal money for education to defy President Trump's demand that schools reopen? And for you, Secretary Wiesman, would you point to the numbers that would really reinforce what the governor says is the good news about people wearing masks? How is that truly showing up in the number of cases that we have, which seems to be continuing to rise?
Well, in answer to your question, Essex, it's just not going to happen. This is an individual who has a modus operandi of threatening things to try to intimidate people, and it's never worked for us, and it's not going to work on us. He has been taken to court and beat over 24 times by our excellent Attorney General. He threatened us months ago to saying he had total control of our state and total authority. What a bunch of baloney, and did nothing about it. He threatened to invade the state with armed forces, which never happened and wasn't going to. And now he's threatening something that's just not going to happen. And what this is, unfortunately, is a repeated strategy of trying to distract Americans from his failure of leadership on COVID. And I think that's really sad because it's cost us big time in our fight against this pandemic. So we are going to make every effort, and we have a good plan for having on-site instruction in our schools. And we have a way to do it, giving flexibility to schools to do things that are smart, to maintain public health at the same time we have on-site instruction. But this is just one of the many, many circumstances where Donald Trump is way over his skis, trying to do orders by Twitter without thinking about the thing through and trying to distract us. So we're gonna maintain our concentration on educating our children in a way that's very safe. And I'm glad we're on the beam in that regard.
In terms of face coverings, we've been working with Yakima and Benton Franklin counties, I think, as you all know, and looking at the campaigns they've been having now for a number of weeks to encourage people to mask up, to open up. And we've seen great increases in face covering usage there. Yakima went from 35% to 65% in a matter of a few weeks. And informal conversations that we've had with folks in Yakima suggest that since all of these orders went into place, that face covering usage is up even more than that. They are going to be doing weekly surveys, and so we'll be looking forward to continuing to get their numbers in. And in terms of Yakima, I mean, this is encouraging news. While they are a hot spot of having a lot of activity, at the peak a few weeks ago, they were at over 700 cases for every 100,000 population in a 2-week period of time. And now they're down into the 500s. And so to us, that's encouraging news. It says to us that the community is taking this seriously, and we're hopeful that we'll see similar results like that around the state as people mask up. And the evidence certainly is out there for face coverings being protective. It helps keep those droplets from going into the air and infecting others. And we've seen in other states who have implemented these that the rate of infection slows down and actually starts slowing down even in a matter of 5 days. So again, we're confident that Washingtonians are going to do the right thing and are doing the right thing. My own informal observation as I walk around where I live is that a whole lot more people are wearing the face coverings and heeding the message. And that's what we're going to need to do in order to stay on the path that we want to be on.
What we're seeing, if I can add to that, look, there's a clear conclusion here. Washingtonians are ignoring Donald Trump, and that's a really healthy thing to do. They're wearing masks by the millions, while he tries to say this is a hoax and somehow is going to disappear in the next few days. This is a good sign that Washingtonians are following science. And I'm glad that that's the direction we're going in this state.
Next question comes from Joe at the Seattle Times.
Two-part question. Can you hear me? Hello, can you hear me?
Go ahead. Go ahead. The situation is we have to mute just at the right moment to prevent reverb.
Joe, we can hear you.
Can you hear me now?
Ask your question.
Joe, I can hear you typing.
Joe, if you can email me. Our next question is going to be Gary with the
Gary? Gary, we're trying to receive you here. Jerry, can you try one more, please?
We're going to try Jerry one more time. Jerry, could you try to speak into the microphone, please?
Sorry, Jerry, if if you can send us a text message or something, we'll try to answer your question, but we're gonna.
It's my turn.
I think you were waiting on Joe. Can you hear? If it's going clearly, I'll ask my question.
I'm glad we waited.
Okay. I'm not hearing one way or the other. I see a thumbs up. So let me switch to another tool in the weapon against this virus that you have talked about in the past, Governor. It's the contact tracing. You've marshaled the forces. There's an army available, but as the number of cases increase, especially in some of the larger counties, it seems like the local health districts are getting falling behind, and the percent of contacting people quickly is falling way behind the state target. So why do you think this is happening, and what changes are you considering to improve the success rate of contact tracing and case investigation?
Well, fortunately, we had the foresight to train people to do the contact tracing of about 1,000 people. We've had quite a number of guards already doing that, and now we're bringing in several hundred more members of the National Guard. And we are bringing in probably several hundred members of other state agencies that have been significantly trained. So they're going to go into the front lines here shortly. As this activity has increased, so is our number of personnel that we are putting in place to do the contact tracing. So that'll happen in the next few days so that we can keep pace with this contact tracing. And you just have to continue to raise your resources as the number of cases are going up, and that's what we're doing. And I'm glad that we have trained these people so that they're ready to get into the battle. And it's not a battle, it's a health issue. Let me just put it that way. John, do you want to add anything to that?
No, the governor's right on. We have had about 260 folks between Department of Health and the National Guard working on this. We're bringing in another 260 folks out of the people that have been trained, as the governor said. So we are increasing our resources as the case counts increase. And that's exactly what was intended, the ability to be able to surge when we need to.
What we're trying to say is the plan is working. But we always have to hurry because the virus is in a hurry too.
Okay, I think we're going to try Joe one more time. Joe, if you can give it a count of 5 and then ask your question.
Hey, can you hear me now?
Yes,
Hello?
go ahead.
You're getting the thumbs up, so I think they can hear you.
Okay, two-part question for either the governor or Secretary Weisman. You mentioned last week in the move to take Benton, Yakima, and Franklin counties to 1.5, phase 1.5. You said part of the reason was because people were going to other cases. So I'm curious if the state has identified specific case increases in neighboring counties that could be traced back to Yakima, Benton, and Franklin, and what does that picture look like? And the question is how can contact tracing be timely and effective in regions that are experiencing delays in getting test results back?
John, do you want to address those?
Sure. So at this point, I don't have the information from case and contact investigators to suggest that a lot of cases have come from other places. We've heard about some people who have traveled to Yakima or the other way who were visiting. So we know that it's definitely happened to have that kind of transmission, which again is why we thought that was the right policy to put in place, and are confident that that is the right piece. And I forgot the second part of your question. Yeah, so testing. So indeed, one of the concerns I think that we have all across the country is that the national labs, when they're running these tests, look like they're getting backed up again in terms of the turnaround time, which is not a good thing, because we know that people are most infectious really early on in their infection, perhaps even before they have symptoms. So it's important that that get turned around. In Washington State, we're fortunate that we have a number of local labs to have a capacity for at least 20-some thousand tests a day, and have, you know, the quicker turnaround time because they don't have to be shipped out of state and come back. So we're working with healthcare providers to make sure that they know about that they are able to send their tests to our local labs in Washington state.
Yeah, we've seen some circumstances where some communities have been waiting for the national labs to get reports back, but we have capacity internally, and we've shared that information for them, with them. Unless they're contractually inhibited, we're encouraging them to use local labs that do have this capacity. So as many things throughout this pandemic, it's trying to get the information to the right people as quickly as possible, and that's what we're doing.
Thanks everyone for hanging in there with our tech issues. For the next questions, if you can ask your question, the governor will give a thumbs up if he can hear you, and then you can proceed. Our next question comes from Keith with Como. Keith.
Hi, Governor. Just checking to see if you can hear me. Governor, this morning you tweeted to the president, just do your job. What did you mean by that? And for Secretary Weisman, where do we stand on PPEs in this state?
Well, listen, from day one, our nation needed a leader to vigorously, comprehensively, and using science attack the COVID pandemic. And for day one, without exception, Donald Trump has muffed that opportunity, and he continues to do so. We, for months, were trying to get him to help use the Defense Production Act to actually produce PPE for our hardworking nurses and long-term care facilities and emergency responders. For months, we asked him to increase the production of test kits. And after months of asking him to do so, some of his agencies started to help. And now, instead of helping us follow his own scientific community at the Centers for Disease Control to be helpful in the decisions of how we reopen our schools, he adopts this tactic of bullying and intimidation. That is not helpful for any governor, Republican or Democrat. So if he can't be helpful, we would prefer that he just give us some useful silence. Let the states lead on this, which we're doing. And I'm pleased at the progress we are making, even in difficult circumstances here in the state of Washington. Now, it also does not help that he attempts to distract us from our mission statement on COVID, on every divisive thing he could find. Take the Dreamers, for instance. I mentioned them. We have some of the best students in the state of Washington protected by the DREAM Act. The courts have now shown that they were protected, and he was wrong to try to take that away from him. But instead of helping unify us to help the education of these students, he's trying to throw them out of the country. And this is frankly just infuriating. While we're trying to provide education for our children, health care for our children, he's trying to divide the entire country. And this has been very injurious to our efforts. But we are undaunted, and bullies don't work in Washington State.
And in terms of personal protective equipment, right now in the state, we're in a much better place than we were in terms of being able to fulfill requests in late May. And now we're able to not only fill the tier 1 requests, but really able to fill most of the requests we get in tiers 2 through 4. And the hospital supply system chain is also doing better. So at the moment, things are on a much better footing than they were earlier in the outbreak. We have, as a state, been able to procure personal protective equipment and have equipment in our warehouse to be able to get out to folks. And we are looking at the ability to also stockpile some of that for the fall and any other increase in demand. But I think going back to the governor's sort of piece here, there really has been a lack of a national strategy for this. You know, each state has been left to compete with each other and against each other. And with the outbreaks increasing and the surges throughout the rest of the country, we're all watching this very carefully and concerned that the personal protective equipment remain in production. We need to increase production because none of us want to be in the place that we were earlier. And we're certainly hearing early reports now in some of these other states that there is a lack of equipment. And so at the moment in Washington state, for now, we're in a much better place. But we're watching that every day and doing our best to make sure we have the resources we need.
Here is a man in the first part of this said that this was going to go away the next week. In the middle part of this, he refused to help us get test kits and PPE. And now this part of us, he again tells us it's just going to somehow magically disappear. This is the last person in America who should be able to make any decisions about the health or education of our children. And that's the way it's going to be in the state of Washington.
Next question comes from Laurel with the Spokesman Review.
Hi, Governor, can you hear me?
Yes.
Okay. So I'm wondering if you could give any examples of other measures that the state could take if it turns out in a few weeks that masking isn't enough, whether that be rolling counties back or changing requirements for certain phases. And at what point would you start to consider those?
Well, as I've said, we look at this every single day, and we look at, probably a dozen metrics to determine whether the pandemic is going at a rate that justifies taking some of the very hard decisions that we had to take earlier. And those decisions that we took earlier were all things that potentially could be things we would have to do again. And we would start at the most recent that we had relieved and work backwards. But again, I hesitate to spend a lot of time planning for that. We're trying to plan for success here. And we are very frankly confident that we're getting success because Washingtonians are masking up. Businesses are showing leadership of helping in that, to helping their patrons to make sure that they wear a mask. So we are planning and looking forward to success rather than failure. But look, this is just a reality. This virus is a cruel beast. And we have to realize that it is growing in our state. So let's get together, let's mask up so we can open up our economy. That's what we're about.
Next question comes from Austin with Northwest News Network.
Hello, Governor. Can you hear me? Thank you. I'm hearing from a lot of parents who are frankly skeptical about the fall and reopening schools. And to that end, I'm wondering about, for instance, in South Korea, I think there's an effort to get laptops and technology into the hands of every child. They haven't reopened their schools, I don't believe. Why is there not a summer effort to put air exchangers in classrooms to perhaps appropriate larger spaces outside of schools where kids could meet and have more room for social distancing? I know you've used that World War II analogy a lot. Where is the Marshall Plan, if you will, to reopen schools and to make that a successful endeavor this fall?
Well, districts right now, as we speak, are thinking exactly about those plans. And I will be meeting with the superintendent next week about the status of those plans. They are thinking about all of the options physically to be able to accommodate these health requirements, from distancing to plexiglass to cohorting people so that the same kids only socialize with a given number of people. They are thinking about these issues, but we've got to give the local districts some time to really think about what works for them rather than dictating to them a one-size-fits-all situation. Now, I do believe, and I had a meeting this morning with my staff about starting to think about potential financing of some of these issues. We do not have an answer for that yet, but we've got to hear from the locals what they think is most needed before we make sort of a state plan to help out in this situation. Now, we also hope that Congress will step up to the plate. There have been any number of proposals. I know our congressional delegation are making proposals for Congress to help our local school districts as well. But I do believe there's a lot of creative thought being given about how to do this. And what I think will happen is it will not be a one size fits all. I think that different districts will find different innovative ways to provide this. And the plan at the moment is to allow districts to have multiple plans available to families depending on what their preference is. There may be some families that prefer all remote education. There may be some that prefer one schedule versus another. And what we're hearing is that the districts are going to try to provide a menu of options for different ways to go about this. So this is a work in process. It's not done. And as I said, we're going to have some more thoughts on this next week.
We have time for a few more questions. Next question comes from Alexis with the News Tribune.
Governor, can you hear me? We're halfway through the 2-week pause on advancing phases. Are you seeing indications that make you think that pause will be lifted on the 16th or after the 16th?
The jury is out, and I wouldn't want to make any real predictions about this. As I've said, we look at these every day, but we try to look at 5 or 7 day averages. So I can't make a prediction. And I just will tell you, we'll make the right decision at the right time. I can't give you any certainty one way or another. I can tell you that this virus is growing in our state, and it's growing in many, many parts of our state. This is not just a couple of hot spots. A month ago, we had just a couple of hot spots. Now this is a wider community spread in many, many parts of the state. That's obviously concerning. So that's the best I can tell you right now. And I've kind of said this before, but it bears repeating. If we want to move ahead, we can put on masks, and that's something we can all do. And that's the thing that makes it more likely that we can continue to move through these phases. John, would you like to add any more clarity on that?
I would just reinforce exactly what you said. We're looking at the numbers. Many counties are increasing in the number of cases, as the governor said. That's concerning. But again, we have the tools. We have the ability to move forward, and that is making sure that we are wearing our face coverings, making sure we're washing our hands, and making sure we are watching our distance with other people and keeping that at least 6 feet apart. And so if we do those things, we can move forward.
Next question comes from Hannah with Cairo Radio.
Governor, can you hear me? Okay, a couple of quick ones. First, with some schools planning already to have hybrid models and possibly all remote learning moving forward in the fall, do you have any plans, or are you considering any plans to issue emergency orders to ensure that employees have flexibility from employers when school starts, such as like a mandated pandemic flexibility plan or something to that end? And then also for Secretary Weissman, on the testing question, the delayed testing on the national part, I know personally of tests that are taking 7 days to get back from national labs. What does that do, that kind of a delay in our current situation for test results in this state?
John, you want to go ahead and answer that?
Like that are extremely harmful. And they're harmful because they don't allow us to quickly try and contain a case. They're harmful in the sense that taking that long, we know people are most infectious early on in their infection. And it is why we say to anybody who's getting a test, if you have enough reason to get a test, then we do want you to stay home until you get your test results. And depending on your situation, if you had symptoms and you've tested negative, then, in all likelihood, if those symptoms are improving, then you're okay to move forward. But if you tested negative and just had contact with someone, 7 days ago, we still need you to isolate or quarantine for 14 days. So the point is that delayed test results don't allow us to move into action as quickly as we would like. They mean that some people have to stay home longer than they should need to, and just doesn't make for the rapid response that that is required in this pandemic.
What I would add to that is that some of these delays we think are because hospitals and providers have traditional suppliers of their lab services. And those traditional suppliers are getting backlogged. And the reason they're getting backlogged is we have such explosion of cases in Texas and Florida and Arizona, and that's backlogging the national labs. And that this is a reason why what I'd call the traditional labs are having trouble keeping up. So in that circumstance, we need the hospitals and the others to be creative to look for other lab capacity in the state of Washington, which we have. And so we are encouraging them to, if they are experiencing these delays, to look at the University of Washington, look at some of our public health labs, call the State Department of Health, because we think that there is additional capacity that can be used in a much faster basis. You asked a question about flexible work. We have not considered policies in that regard at the moment.
We have time for one more question. I would like to thank everyone again for hanging in there with our technical issues. Last one comes from Carolyn with the South Seattle Emerald.
Hi. So I'm actually, I think I'm having a little bit of issue on my end. Governor, if you could just say something and then my screen will unfreeze. Let me know that you can hear me.
You're good. You're good.
Thank you so much. This is for either you, Governor, or Secretary Weisman. I'm sure you saw the new federal data released over the weekend that showed Black and Latino communities are 3 times as likely to catch the virus and twice as likely to die from it. Given this disproportionate impact, do you have any specific outreach plans in the works for these communities, particularly since it's mainly Latino communities who work on farms in Eastern Washington and places like Yakima, which is currently suffering a massive outbreak? And then along those lines, do you have any updates regarding a state relief fund for undocumented workers?
Well, yes. Again, we hope in the next few days to put the finishing touches on a fund for undocumented workers. It's been very frustrating to me that that has not been wrapped up yet, but there are some procedural and legal hurdles we have to get over to be able to fashion a very creative solution to this. This is important both because of the humanity of these families, but it's important so that they have the ability to isolate and not go to work sometimes for 2 weeks. So we want to get this up as quickly as possible. But in answer to your question, yes, there's a whole host of issues we have that are targeted to help people in the agricultural community. And these people are people who make sure that we have food throughout our state and some of the hardest working people in the state. So we have a very intentional educational effort to share information with them, frequently in Spanish, obviously, and other languages. And the PR campaign, it's a multi-million-dollar campaign to be able to share information with them. And we're trying to start that up in the next week or so. So the finishing touches are being put on that. You know that we've put into place, I consider comprehensive rules in the agricultural industry to try to protect people to the extent humanly possible. And it has not eliminated the risk. There's no way to eliminate the risk of COVID in the agricultural industry, but we have put into place what I believe are robust and comprehensive rules involving masks and cohorts and hygiene and transportation. And we want those to be followed. Those are legal requirements. Now, some of those are somewhat irksome to people doing this hard work, people wearing masks sometimes. But listen, this is a matter of life or death, and we want everybody to go home safely and not infect the rest of the community. On the health impacts, the ability to get health care is obviously of central importance in this regard. And one of the most important things we're doing is to try to stop health care from being taken away from the people now in the agricultural industry. Thousands of people today have access to health insurance. But Donald Trump is trying to take away that health insurance from them by dismantling the health care reform that passed several years ago, which is pretty amazing to me in the middle of a pandemic with the people who feed us and work hard to do so, to have a president to try to deny them health care. But that's the situation we are in. So we are on a full-throated effort to protect that that system of healthcare that we have made available to people. Because, by the way, it's not just important to them, it's important to all of us. Because the more we can test and treat people in this community, the less they will spread the disease to other folks who are not in their family. So this effort to deny them health care by the president is not just a threat to those who are on health care reform. That is 800,000 people in my state. 800,000 people today have health coverage if they get infected by COVID. And so what he's doing is not trying to deny just them health care and the ability to get tested on their health insurance policy. That jeopardizes everybody else in the state, because if those people get sick and if those people are untested, they infect other people. So that's why we're in the fight for our lives, and we're sticking together in our state. And I'm proud to be a state that believes in science and won't be bullied by anybody in Washington, D.C.
Any final words, Governor?
No, I want to thank everybody. One other thing that we did not talk about, if I can just notice, there's a group of people that are very important to us in beating COVID right now. And that's people, you know, under the age of 30 or 35, pick a number. It's really vital that some of the young leaders step up to the plate and remind their friends that socializing in a group of 5 or 6 or 8 or 10 or even 3, not wearing masks, shoulder to shoulder, even on a sunny day having a soda pop or a brew, that's just too dangerous right now. And we are seeing a rapid spread of this disease by younger folks because of that activities, frankly, when they're not at work. So we're doing everything we can to protect them in a store, to protect them at work. But if they go out and socialize like we all like to, and are not protecting themselves, we understand it's not as dangerous to a 30-year-old as it is to a 70-year-old. But that 30-year-old who may not be affected or affected at all by this disease can go to their dad's birthday party or their mom's birthday party and infect them the next week. And so this is a risk, and I just want to try to talk to some of the younger folks in our community and ask them to be heroes, even if they're not worried about their own health. Look, we realize that young people have a much better outcome than older folks, but they're just as dangerous to the rest of us in the community. So I hope when you're thinking about going out to the next party, you can give some thought to the people you love and help us out here. So with that, thanks a million. Wash your hands, mask up.